Hello everyone, my name is Mary Narsa, and today I will discuss with you the need for a change concerning healthcare professional roles in relation to attendance policy and timekeeping. We are in need of a timekeeping revolution. Current job functions of healthcare professionals have a greater number of tasks put upon them with increased complexity and a requirement to do more with less. According to Beaufort Longest, the nation's rapidly aging population, coupled with the increased number of insured people triggered by the Accountable Care Act, will strain a healthcare delivery system already struggling under the weight of its current load. What is needed, based on this pressure, is a new approach to national health workforce policy. This goes back to current organizational structures where there hierarchy and a need for heterarchy organization needs to occur. Hierarchy is based on the industrial age where there's a focus on mass production, compartmentalism, and efficiency with top-down control. Workers are categorized as employees and seen as functional personnel with a fixed set skill driven by process. In our current age, we are now driven by information, which considers whole thinking processes, integration, synthesis, and action based on team environments. It also involves the knowledge worker, where you have individuals with specialized training that utilize multiple intelligences to perform their work. They're now professional with a specialized skill set that is provided for the healthcare environment. Currently, these roles fall under the non-exempt or hourly rate pay model, which involves timekeeping and attendance. These current position designations hinder the work of the professional and the organization as a whole. The worker has great stress in maintaining the clocking expectations, where if they're running late, they could be driving erratically, running to the clock, starting their shift off with unnecessary stress. This creates reprimand due to the policy. It's very impractical. It causes a loss of the value in staff and a high turnover rate due to this loss. Staff is extremely devalued with this or these policies as well. The organization as a whole has an inconsistency with its mission, vision, and values, especially if it's driven by a newfound purpose and innovation. It creates unnecessary expenses from the loss of staff and due to training of new hired personnel due to the high turnover. Overall, these positions could be leveraged better by simply changing their status from non-exempt to exempt. It would also eliminate additional pay categories such as overtime, on-call, and holiday pay, because it would all be included in the salary that would be negotiated at time of hire. The current policy within my organization is specific to attendance that I'm going to discuss. This enforces the control based on timekeeping. It is inflexible to the maximum of 40 hours per week and a requirement for overtime of any hours in excess. It does not accommodate work needs such as shift overlap, especially for 24-hour operations and if staffing problems arise. these highly controlled and complicated policies are directed mostly to the point of service staff who maintain the work and provide the services. To touch upon these specific policies, or this specific policy for attendance, the purpose of it is to establish guidelines for employees in order to ensure uninterrupted quality and efficient healthcare services delivered to the patients and ensures efficient operations of the facility. It also specifies that the population is all employees. But it really isn't the case. Employees are required to abide by their assigned department schedules in a dependable and punctual manner. Employees are expected to arrive at their destination or work area promptly at the start of their shift and after their rest or meal breaks. Excessive incidents of absence and tardy are seen as a performance problem, and are counted as occurrences following an escalation model towards corrective action, which could lead to termination. Of course, federal mandated exceptions are considered, such as short-term, long-term disability, military leave, jury duty, leaves of absence, and so forth. But overall, it's highly controlled and structured to ensure that people are in a specific place at a specific time to do the work, although they're already doing that to the best of their ability. To keep business in mind, those performing the work should have the most resources, the flexibility, and the support to drive the outcomes. Leadership, who are mostly, or actually all considered exempt roles, do not fall under these constraints. And they do make decisions, but they're not directly involved in the work or drive the outcome. Business practice, in reference to the generation of capital to run the business or the hospital or healthcare organization, is bottom up, where the workers at the point of service ensure that the service is provided to create the income, and the executives and leadership do not. Workers maintain the strategy to drive the outcome. So how did this become the norm, where the majority of healthcare roles are an hourly wage? Well, the U.S. Department of Labor had mandated specific guidelines on minimum wage and maximum hours based on a work week. Overall, most organizations manage this through human resources, which are trained on these common practices of minimum wage and maximum hours. In relation to a non-exempt versus an exempt role, non-exempt is your hourly wage employee. These are mostly made up of knowledge workers within the healthcare setting, such as nurses, medical laboratory scientists, radiology technologists, pharmacists, etc. These individuals work at the point of service. They have the greatest impact to the patient, but they work with very inflexible working hours in relation to the pay status and the necessary requirement of utilizing a timekeeping system. An exempt role, on the other hand, is all of your executive, high-end roles, leadership roles that are far removed from the point of service. they have the greatest impact on the employees, but these are salaried, and so they have flexible working hours. They come and go as they want, simply because their role has been categorized as one that does not get paid overtime. In reference to Porter, O'Grady, and Malik, the issue is no longer doing more with less. Instead, questions are about doing and being different in a changing world. This is extremely necessary with healthcare today and how healthcare has changed and the need for healthcare has grown. And therefore, the cost is increasing to provide the service to those who need it. In reference to the current attendance policy and the division of labor between exempt and non-exempt, exempt employees are simply defined as an employee in a position not eligible for overtime pay per the Fair Labor Standards Act. Non-exempt employees are employees in a position eligible for overtime pay per the Fair Labor Standards Act. So the only difference is whether or not the role is designated for overtime or not. To further explain the specifics for each designation, non-exempt employees are responsible to check for schedule changes, work the shifts assigned to the schedule, accurately record the working or time worked using the time management system, approve their time cards. It does specify that a non-exempt employee who does not comply with the schedule may be subject to corrective action up to and including termination. A non-exempt employee leaving the facility for personal business for a period longer than 15 minutes will have to inform their manager. It's just highly controlled. Where on the other hand, exempt employees has a very generalized, short reference to this policy. An exempt employee is generally paid based on the performance of the exempt role, not on the number of hours worked. A full-time exempt employee is generally required to work a minimum of 40 hours per week. The department leader may establish expectations with regard to schedule, and the exempt employee may be subject to corrective action for failing to meet this expectation. Exempt employees will not be subject to reductions in pay based on the number of hours they work, unless such reduction is permitted under federal and state law. Exempt employees are responsible to approve their time card, so on and so forth. This little blip is all that is mentioned in the policy. Within the snippets that I have provided in this presentation, non-exempt employees are the identified population being directed under a controlled situation with corrective action in place that is sometimes unreasonable and can lead to termination. Again, I would like to point out that the non-exempt employee is associated with the point of service staff. This is the staff that drives the work. The point of service involves the greatest amount of work for the organization, especially within healthcare. In researching the history of this attendance policy with my current organization, in 2010, I found this snippet concerning illness accumulating points toward corrective action. So here it asks a question where, why can't an incentive be implemented for people with perfect attendance? This could help potentially alleviate the number of sick calls that occur because there would be an incentive towards always being present on their scheduled shift. The only thing that it discusses is how PTO is available for flexibility. But this is not really the case, because if we refer to the attendance policy, if you do not work your entire shift, you accumulate points, and those points or occurrences are added up and then within a 1-year time frame could lead to corrective action. So the person or the senior vice president who is answering this question really is not being forthcoming to how the PTO is in relation to the attendance policy. And if people are calling out sick due to true illness, then they're being reprimanded, which makes no sense within a healthcare setting. We work in an environment that treats the sick, yet if we get sick, we get reprimanded based on our attendance policy. In 2015, I did find another little blip in reference to a 7-minute grace period being given at the beginning of your shift when clocking in. What was discussed is how the policy had become standardized across the system or the organization, and there really was no grace period because the timekeeping system would not really allow for that. I honestly think that a timekeeping system could be modified in any way to work to whatever ability would work for that institution. But they're saying that there's no grace period because they want people to be at their station when their time scheduled is to start. So again, clocking in became more rigid. There was no grace period. The expectation was to be at your workstation at the expected start time. In 2017, there was another update due to Arizona law changes where Arizona sick time had been voted in by the state. What this means is that we are, as Arizona employees, we are allowed 40 hours per year to be used in any manner in relation to sick time or sick leave by statute. This also changed the number of occurrences to initiate corrective action to be decreased from 7 to 5. So now, again, more control and more stringency. But Arizona's sick time was added as an exception and allowed a little bit more flexibility in relation to the use of those hours. I also directly asked some questions to our Director of Talent Acquisition and our HR support, and it was kind of some vague answers that I had received. What is the history of the attendance policy development? It's gone through various updates, changes over past several years, and they are expected to continue. The use of focus groups with leaders and employees were used to review this policy and make changes based on the market. Did it require evaluation every so often? He said no, but I found references that it had to be evaluated every 3 years. Why did it become so stringent? There are various reasons for that. And what parameters determine the role of exempt and non-exempt? We follow the federal guidelines under the Fair Labor Standards Act in determining if a position should be exempt or non-exempt. So, in relation to the Fair Labor Standards Act, Section 13A1 of the FLSA provides an exemption from both minimum wage and overtime pay for employees employed as bona fide executive, administrative, or professional employees. What I had found is that professional employees could be exempt. Comparison to current practices need to be innovative and determine a new approach in categorizing their staff. So to further explain the professional exemption, to qualify for a professional exemption, you have to be from a learned professional or learned profession. These are employees who have primary duties must be the performance of work requiring advanced knowledge, defined as work which is predominantly intellectual in character and which includes work requiring the consistent exercise of direction and judgment. Must be within a field of science or learning, and the advanced knowledge must be customarily acquired by a prolonged course of specialized intellectual instruction. This involves the majority of point of service staff, nurses, medical laboratory scientists, radiologists, physical therapists, pharmacists, physician assistants. These are all individuals who fit this definition. Therefore, they could be exempt and not have to fall under the attendance policy or the time constraints limited by that definition. Porter, O'Grady, and Malik did state that in the current world of work, it is not the organization but the worker who owns the work. The character of work changed substantially at the end of the 20th century. It became increasingly technical and complex, often called knowledge work, and now individuals usually need to be trained for jobs before they become eligible for them. Further, organizations' increased dependence on knowledge workers has created a new power equation, shifting the locus of control from the organization to the worker. This basically means that there has definitely been a change between the industrial age to the knowledge era or the information age. And the point of service, which includes all knowledge workers, are professionals and should be treated as such. So, proponents for my proposal of making professional workers exempt employees is that this would create professional recognition. There would be less focus on control and more focus on the outcome or the role of the work. There would be greater flexibility, autonomy of the role, and collaboration, because there would be no more control under an hierarchy. Everyone would have to work together in teams to drive the work and promote success. These would be salaried positions. There would be cost effectiveness due to the elimination of overtime, holiday, shift differential, etc. It would reduce staff turnover, and the expense from new hire training would be greatly reduced. Opposition to this proposal is that leadership would become more of a supportive role over a management role. I know current leadership positions include personnel who have this old way of thinking, and it might not be so tempting to them to change and lose that control that they have. There would be a possibility of frequently working over 40 hours, which would not have any additional compensation based on an hourly wage. There would probably be a concern for promptness or staffing with scheduled shifts due to being late or weekends or holidays being called off. But again, this would be a transition over time and would require a change in approach to the positions. Salary position means no overtime. A lot of people who have been hourly in these roles may not like the fact that they would lose that benefit from their perspective. And it might be possible, or there might be possible difficulty in covering these odd hours, such as second shift, third shift, weekend hours, holidays. But again, this could all be negotiated within the hiring process. The authors of The Power of Positive Deviance had discussed how across the country you have to change skewed incentives that reward quantity over quality and reward narrowly specialized individuals instead of teams that make sure nothing falls between the cracks for patients and that resources are not misused. The solutions lie in producing creative ways to ensure we serve our patients more than our revenues. There needs to be a change in thought, in perspective, in organization, in interaction within healthcare. So my innovation and proposed reform to the current attendance policy is to generalize all professionals under the exempt section of the attendance policy. Eliminate the corrective action. It'd be less complicated and would have a positive effect on the majority of the staff. By making professional roles exempt with negotiated salaries for special shifts, solutions could be made to cover those areas of need and create the flexibility needed within those roles. What does need to occur is an evaluation of current professional salary structures for expansion to new point of service professional roles. This is highly seen like within physician, medical student, resident positions where they work on call, they come in on the weekends, they come in on the holidays, but they're paid as salaried personnel. By expanding the autonomy for the point of service role, this would create value for these positions, for these people. It would also enforce accountability, responsibility, and creativity for them to provide the service. It allows for professional freedom to expand collaborative efforts, work as teams with other professionals to drive the outcome of patient care, and it incorporates the community into the decision-making of the organization, meaning that the workers as a community will have the freedom to make the decisions to do their jobs. It also adapts the leadership role into a support and collaborative work engine or pass-through. They're not managing the operation. They're helping the staff achieve their goals to provide the service. Overall, this is part of the mission, vision, and values. It would target competent individuals, creates a learning environment and collaboration. It fosters ideas, innovations, and pushes forward positive results. It rewards the staff and encourages retention of staff, which will reduce turnaround. And it will also create a better corporate culture and a better reputation of the organization from an employee perspective. Thank you so much for your time, and I hope that you found this perspective interesting.